Spring sports like track and field and soccer often lead to sprains and strains from sudden movements. Shin splints are common in runners, while soccer players frequently suffer ankle injuries. First aid includes rest, ice packs for 20 minutes everyone, 2 hours, compression with an elastic bandage, and elevation. In summer, swimmers often face shoulder injuries from repetitive motions, and cyclists may experience road rash from falls. First aid for shoulder injuries includes rest and ice packs. For road rash, clean the wound, disinfect, and cover with a sterile dressing. Heat-related issues require moving to shade, hydrating, and cooling down. Fall sports like football and cross-country can lead to knee injuries, including ACL tears. First aid involves rest, ice packs, compression, and seeking medical evaluation for severe pain. For blisters, clean the area, protect with blister pads, and avoid popping them. Always monitor for concussion symptoms and seek medical help. Winter sports like basketball and skiing often result in ankle sprains. First aid includes rest, ice packs, compression, and immobilization. Frostbite is also a risk. Warm the affected area gradually and avoid rubbing. Seek medical attention for severe cases. Always wear appropriate gear and stay hydrated to prevent injuries.